discussion of the respiratory system. Just kind of introduce the idea of it right here a little bit. Respiratory system, really the whole idea here is to bring air in for normal cellular respiration. A lot of this involves different parts of the respiratory system. Again, all this is to get enough supply of oxygen to the cells and make that available so they can generate their energy and remove the carbon dioxide waste that they generate. Really, the respiratory system is providing the gas exchange for this to happen. We talk about respiration being the collective process, like it says there, of that switch over between oxygen and carbon dioxide within the body and to the atmosphere. And again, this is not just a respiratory system that's doing this job. The respiratory system is just bringing the gases in from the outside to where the gas exchange can take place. We then have the skeletal system, the muscular system, the cardiovascular system, as well as the nervous system, kind of all working together to regulate different parts of this in terms of when we're breathing, the actual movement with the muscles, the cardiovascular system moving the blood around that's carrying the oxygen and carbon dioxide are all involved in this. Really, we have a couple different things going on here. We have really two main functions that this is producing. It's providing an air passageway to get the air from the outside into the alveoli. We move the air from the atmosphere in. We move the air from inner lungs to back out to the atmosphere. That's through that air passageway. The other thing this is doing is providing us with a place to exchange these gases. So when you get down to the bottom of the lungs, you have the alveoli, and these are in close proximity to capillaries. And this is what is going to allow that exchange of those respiratory gases. Other things that the respiratory system is doing definitely brings in the air to the upper regions of the nasal cavity where we have olfactory receptors, and therefore we can detect that. The other thing it does is what I'm doing right now, lets you generate sound by pushing air over your vocal cords and generating a vibration of those vocal cords, and then using your upper respiratory chambers and cavities there to resonate and produce these different sounds. Really, when we are breathing and the stuff we do with breathing, it is really going to regulate a lot of different things. It can regulate blood levels of oxygen, blood levels of carbon dioxide, because of how we carry carbon dioxide, which is one of the things we'll talk about later. It also regulates hydrogen ion concentration and therefore blood acidity levels. Outside of that, it is going to be involved, as we've already said, in kind of being one of those pumps along with the skeletal muscle pump to cause the venous return of blood to the heart, as well as return of lymph to the venous system. Again, when we're talking about respiration, we can talk about a number of different levels of this. Overall, if we talk about pulmonary ventilation, this is just the idea of breathing. Breathing in, that inspiration, breathing out, that expiration. We can then, once we get the air into the alveoli, we can talk about external respiration or pulmonary respiration, which is moving those gases from the lungs to the bloodstream. We then have to worry about how we're going to transport those around the body. And then once it gets to the capillary bed, getting that internal exchange going on, that tissue respiration, where O2 and CO2 are going back and forth at the capillary beds. Again, it's a lot of different tissues involved in this. We can usually subdivide it into two main parts. We have the upper and lower respiratory tracts. The black line on the image is kind of showing that. And really, when we look at these different structures, they're really, for the most part, doing one of two things. They're either serving as a tube to conduct those gases to the exchange regions, or they're providing an exchange site. When we get to it, we'll see that the alveoli are the only places that the gas exchange is taking place, and really all the other structures are really about conducting those gases down to the alveoli for that exchange to be able to take place. Like I said, the upper respiratory tract is everything larynx and above. Lower respiratory tract is from the larynx down, so the trachea and everything below. So those conducting zones, like it says there, are really from all the way up in the nose to where we're getting very close to the ends of these branches. We'll see when we look at it that the bronchial tree, a lot of times what they call it looks a lot like a tree with a lot of branches, main trunk, and then branches upon branches that spread out on this one. As we're getting to these smaller bronchioles called terminal bronchioles, that is the end of the conducting zone. Once we get past that, when you're going into these dead end regions where the alveoli are, those are what we call respiratory bronchioles. And it's there and at those alveoli that we consider the respiratory zone. As we look at this, we're going to see, and we'll see the similar thing when we talk about the digestive system. There is the whole system in the digestive system, for example, has 4 main layers. We'll see a similar thing with the respiratory system as well. You have what's called the inner mucosa. This is the innermost layer that's lining the cavity, lining the lumen. This is going to be epithelium resting on a basement membrane with a little bit of connective tissue underneath this. One of the things that I can't say is what type of epithelium it's going to be because it is going to depend on where you're at. A lot of it is going to be pseudostratified with cilia, especially in those conducting regions. But as we get to other parts of it, it does change the type a little bit. By the time we get to the alveoli, it is simple squamous there. And we're going to see some more cuboidal kind of in the middle as we work our way down there. So this is showing you that mucosa, the connective tissue underneath with that pseudostratified epithelium on top. Again, as you work your way down, it tends to get thinner and thinner the further we go down. So in the nose and alveoli, there is a lot of in the nose, it starts out, and in the trachea, we got a lot of pseudostratified. As we get further in, we get ciliated columnar. If we get down into some of the smaller bronchioles, you have simple cuboidal, and then it gets to that simple squamous. So we'll see that there is also certain areas in the throat region in that we are also going to see some stratified squamous as we pass through certain areas. But this can, again, kind of gives you, as you work your way down, we get thinner and thinner epithelium because by the time we get to the end, we want to provide exchange. Where the rest of these, a lot of cilia, in order to anything that gets in there gets trapped in the mucus, we can move it back out. Again, a few areas that are a little different. The oropharynx, the laryngopharynx, these areas have stratified squamous epithelium of the non-keratinized version. And again, it's because we're eating things, swallowing stuff. There's more mechanical abrasion that can happen on these areas. And because of that, we have to have this type of epithelium to kind of protect that area with that abrasion that would be there. One of the other things we see is, because this is open to the outside, it is what we refer to as a mucous membrane. So we have a lot of mucus production. In the trachea, it's going to be a lot of goblet cells putting that stuff out there. Mucus glands up in the nasal cavity, serous glands as well. A lot of these are putting out this liquid substance that contains contains mucin, which gives it that thickness of mucus that we talk about. And what this is really there to do is really serve as a trap. Stuff can get into this mucus and it gets trapped there. And then because we have cilia, we can move it back out of the lungs instead of having it build up in our lungs. Disturbing kind of thing here. We generate anywhere from about 1 to 7 tablespoons of this stuff a day, which is kind of gross to think about. That's basically like a cup of mucus. Within that, there is a lot of those protective mechanisms that we talked about. So immunoglobulins, lysozyme, these things that are going to trap different stuff and help actually be antibacterial or against other pathogens. Sputum when it's actually trapped substances and when it's coughed up. We'll start with on this one and kind of finish with this. We'll talk about the nose and work our way down to the pharynx. But the nose has a number of different tissues that build it. We have hyaline cartilage, some bone that's doing that. Obviously there's skin and then some irregular connective tissue that's holding us all together. You have cartilages on the outside as well as some down the center. You have 2 openings called the nostrils that are letting this air in. And again, we have this oblong cavity, as we'll see here, kind of going this direction, formed by the skull in the back, by the cartilage and other stuff in the nose in the front. And we're going to see there's a lot of folds in this, and then we're going to have an opening that goes into the pharynx in the back. The roof of this is the nasal bone and some of the frontal bone, ethmoid bone, and sphenoid bone. We have a septum, like I said, that's divided in half. Little bony sheet in the back, cartilage in the front. And it's really the combination of the ethmoid bone coming down and the vomer bone coming up to really make that bony sheet in the back part of your nasal septum. And again, these conchae are these really bony folded regions that are lined with epithelium. And these produce a lot of turbulence in that air. Going to help stir it up, trap stuff in the mucus, so it's not just going in like a laminar flow type of way in there, but it gets stirred up, so anything that's in it can get trapped. The other thing we're going to see is the nasal cavity is doing a lot of humidifying and warming of that air, and that's part of the reason we have so much surface area in there and really good blood supply. But each passage, again, an opening called a meatus. You have the vestibule in the front part, the olfactory region in the top part here, and then the respiratory region's kind of a little bit beneath that. So right behind the nostrils is what we call the vestibule. We have a lot of hairs in there. These are, again, they're really there to help trap particles that could be entering into the nose. The olfactory region is the superior portion of that nasal cavity with our olfactory epithelium up there that can get those odorant molecules coming into contact with the particular receptor. And then the respiratory region is beneath that, where the air is traveling through there. Again, lots of mucosal lining, lots of surface area, very close blood vessels to the surface, which is part of the reason nosebleeds can be pretty common. Again, a lot of this is all about stirring this air up, trapping things, moisturizing that air, humidifying the air, warming it up so it doesn't get down to the lungs and damage the lungs. And this shows you all those nasal conchae and all those folds going down in here, all that surface area that's traveling through that. Again, you can see the vestibular area here, the olfactory, and then the respiratory regions, like I said, in between those. There is some nasal lacrimal ducts from when we talked about the eye, that those secretions can drain down from the eye. And again, what I said, the main thing that the nasal cavity is trying to do, and this is part of the reason more often than not you should breathe through your nose. Part of the reason sometimes you get that cough with running outside in the cold, because you're actually getting a little bit of a bronchial constriction due to the cold. But the nasal cavity, the whole purpose of the respiratory tract is to really get the air to the same temperature, to the same humidity, and have it be very clean when it's getting down to those alveoli, so nothing is getting in the way of that exchange. We have this nice clean exchange taking place. So moist environment humidifies it, the cilia and other stuff clean it out, the hair and other stuff trap that, and again, all that mucus in there along with trapping stuff is going to help to moisturize this, and the blood being close to the surface on this one is also going to really help warm that air up. And again, the turbulence caused by those conchae are going to help enhance all this. The other thing to kind of talk about near the nasal cavity is we do have this connection up to the frontal bone. You have and as well as right here, the paranasal and frontal sinuses are both going to drain into the nasal cavity. So you have the frontal sinuses, the ethmoid sinuses, and the maxillary sinuses. And you can kind of see them right here, showing you some of the different ones that are in there. Probably the best image of it is right here. These are those frontal sinuses, the maxillary sinuses, and like I said, the ethmoid sinuses right here. These help to reduce the weight of the skull. These are also one of those things when those ducts get a little bit blocked due to inflammation, you can get those sinus headaches where you feel the pressure on the front of your face. And again, that's really what a sinus infection is getting something up into there where the pressure builds up, the mucus, the stuff that's in there isn't able to drain, and it can lead to those headaches. And a lot of times anti-inflammatories or antihistamines can help open that up and let that stuff exit out. So with the second show, we will get into a little bit more of the lower parts of the respiratory tract.